Now you're welcome back to the programme. As I reminded you before the break, the Irish Motor Neurone Disease Association is holding an awareness campaign from the 18th to the 25th of June. And we thought we'd better find out a little more about this. And of course, they're inviting you to drink tea for MND during this Awareness Week. So I'm joined now on the line by nurse specialist Eithne Cawley and by Deborah Hickey, who lives with motor neuron disease, and Deborah is from Brewery. So you're both welcome to the programme.
Thank you, Sheila.
Can you both hear?
Yes.
Good. Now, Eithne, I'll come to you first because you're a nurse specialist, and I suppose the first question is, what is motor neuron disease?
That's right, Sheila. Good afternoon. Just to explain a little bit about motor neuron disease, it is exactly as it says it is. It's a disease of the motor neurons. Neurons are also known as nerves. And degeneration of the motor neurons can lead to weakness and wasting of the muscles. And in turn, when somebody is diagnosed with motor neuron disease, this can cause increasing loss of mobility in maybe one limb or another, or in two limbs. And indeed, it can cause difficulties with speech or swallow, or indeed breathing. But I suppose it's important to point out that there are different types of motor neuron disease, and the prognosis going forward can be hugely variable, Sheila.
Yeah, that's one thing actually when I read the information, Eithne, this morning was, we all think of motor neuron disease, and of course we associate it now very much with Colin Murray, who of RT, who did that wonderful programme and raised awareness in a big way about the condition.
That's right.
But we think in terms of a condition, we don't realise that there are very many forms of it.
That's right, indeed. And just it's important to point out there's no specific test to diagnose motor neuron disease. And as mentioned before, it's important to note that not every symptom you experience may be related to motor neuron disease. So it is vital to seek professional medical attention if you are concerned, because, as I said, not every symptom may be related to this condition, and it is hugely variable.
Yeah. Who is at risk, Eithne? Is it a congenital condition, or is it something that can strike you out of the blue?
It can strike you out of the blue. It can affect any adult, unfortunately, at any age. Most people are diagnosed over the age of 40, and the highest incidence usually occurs between the ages of 50 and 80. But again, it's important to point out that age of diagnosis is, again, very variable.
Now, what causes this condition?
Well, indeed, that is a million-dollar question, Sheila. If we had a cause, then we possibly could find a cure. So that's why it's so important that we're involved in ongoing research in relation to trying to find a cure for this disease. So there is no known cause for motor neuron disease.
Now, stay where you are, Eithne, for a minute, and
Sure.
we'll bring Deborah in. And you're welcome to the programme, Deborah.
Hi, Sheila.
You're
Hi,
welcome.
Deborah.
Now, can I ask you when you were diagnosed, Deborah, with motor neuron disease?
Well, just like Eithne said there, I was 42 when I was diagnosed back in August 2008. But I was aware of symptoms very slowly developing for about 9 to 12 months previous to that.
And had you, with those small sort of symptoms, had you been attending a GP?
No, because I'll tell you, it was things like, I'm quite a small person, so I used to wear high shoes and stuff like that. And I noticed that I was starting to fall out of my shoes, that my foot I wasn't walking normally, my foot started to sort of drop, like to slap onto the floor. In fact, at work they used to say to me, God, you're like an elephant, we can hear you coming a mile away. it was the foot drop.
Yeah.
And the other symptoms, all of a sudden the weight of a bottle of wine became very real and heavy in my hand. Things like that I noticed about. That was about 12 months before it was actually diagnosed.
So when you eventually went to your GP, I suppose first, Deborah?
Well, actually, I was living in Seattle at the time.
Okay.
The way I was diagnosed was, I actually thought what I needed was an insert for my shoes, so I went to get that sorted. And the doctor, I said, no, he said, you need to see a neurologist. He said, that's a nervous system problem. So after checking the peripheral nervous system, then they did the central nervous system. And once they ran that test, I was diagnosed almost immediately. It took, once I started doing the test, it took about 6 months before they sort of had a final diagnosis.
Came with a shocking surprise?
Oh, it was, you have no idea. Like when somebody says what it is and then they tell you, the prognosis, it was like somebody hit me with a baseball bat and just sucked the air out of the room.
And as a matter of interest, Deborah, as I said, we all hear about motor neuron disease and we think about it, but we don't actually really, I suppose, know a whole lot about it. Were you in that category of not knowing a lot about this condition before you were diagnosed?
Yeah, I knew very, very little about the illness. I remember as a child, Arthur Ashe was on the Late Late Show and he had it. And that was the only thing I knew about it.
Now, you said you were living in Seattle, and many people would say, of course, American medicine at the cutting edge. You're now back in Ireland, obviously, and having your treatments in Ireland. But did you think that being in Seattle at the time was useful, helpful, any of those things?
It's hard for me to say. I think it would have taken the same amount of time to being diagnosed in Ireland. The one thing I can say since I came back, and I've been in contact with the Motor Neurone Association and with Professor Hardiman in Beaumont Hospital, I think I've gotten a lot more support there than I would have gotten in the US, to be honest. And
of course you have your family, which is terribly important, I presume, to be surrounded by people you're familiar with.
Yeah, well, I think one of the, this is a terrible illness and, I wouldn't wish it on anybody. But I've been very lucky. I came back. I'm not married myself, and my sister and her husband, Desiree and Mark, they opened up their home and their family, for me to come live with them, with my niece and nephew and stuff like that. And, that's something I wouldn't have been able to do had I not had motor neurone disease. And in some ways, that's, it's a gift in the middle of all of this, like.
Yes, yeah. Now, in terms of treatment, are you on medication, Deborah?
I am. There's a standard drug that you're given. It's called Rilitech, and what I was told originally when I was in the US is that it gives you about an extra 3 months. But you'll take every day, right?
Yes. You seem to be very philosophical about the whole condition, Deborah. It's very difficult to talk about it for me, and I'd imagine for you too. But you seem very philosophical about the prognosis.
Well, the thing about an illness like this is that you're not going to die overnight, and once you actually get that straight in your head, you start to cope with it. And actually, the Motor Neurone Association was fantastic because when I heard it first, I was terrified. It was very traumatic for everybody. But they were able to point to people living in Ireland that had the disease a lot longer than the standard prognosis, which is 2 to 5 years. And, that in itself, in the early days of the illness, the association was fantastic because they'd been down this road before and they were with us every step of the way. So I couldn't say enough, actually, about the first 6 months, about all the sort of the emotional support that we got from them, just because they knew about it. And they were able to point us in the right direction.
Because the medical support, I suppose, is there. It's the emotional and personal support that's really very much required, Deborah, at a time like this when such a diagnosis is given to you.
Yeah, it is, and they and the acceptance as well that the disease gets harder. Loss of mobility increases over time. So, like, I'm 4 years down the road now. I'm in a wheelchair full time. I have people that come in the morning to the house to help me get up and shower and stuff like that. And again, at night to get into bed and stuff. But I'm still lucky enough, that I can eat by myself. I still do, I can still work a computer and stuff like that. And I still do a little bit of work for Microsoft, and that's actually, Microsoft have been brilliant to me as well, actually, over the last 4 years.
On that very thing of relinquishing independence, you need supports now, you need people coming in to help you. But the computer, I can imagine that, being able to access your computer, all of that is a fantastic support and help to you.
Yeah, the technology is absolutely fantastic. I have just basically what I have at the moment is I just have a laptop and a cheap set of earphones, and that's what I use. If I can't, like 10 years ago, I'd be sitting in a room somewhere watching TV all day. So actually the technology is fantastic.
Back to Eithne now, because Eithne, you, as Deborah said, supply these fantastic supports and provide these supports for people which is a difficult time because, as Deborah said, the prognosis and being told the situation is not easy. So support is terribly important.
Support is vital, Sheila, and I suppose since no cure currently exists for motor neuron disease, what is essential, and I'm sure Deborah will concur with this, is a core multidisciplinary management. So once a person is diagnosed, it's important that they come under the remit of their consultant neurologist and their team, and of course the motor neuron disease nurse specialists. And I'm sure also Deborah would agree that the input from community occupational therapy and physical therapy is also very important. So it is all about interdisciplinary care and providing support to people who are diagnosed, together, of course, with their families who are also devastated, because it's a huge change for people who are diagnosed with motor neuron disease. And there are many losses associated with this disease. But again, when there's good support out there, and believe me, there is an abundance of support. I'm in a very privileged position to work alongside the Motor Neurone Disease Association, and me personally, there are 2 nurses employed by the Motor Neurone Disease Association, and we provide support to people who have been diagnosed, and also support to their families and their carers by means of home visits, or indeed a helpline or a line contact. So my job means that I act as a link in the provision of care from secondary care, which is a hospital setting, once somebody is diagnosed, right back to local level. And I think follow-up in the home is pivotal, because we have to prioritise and organise our home visits as determined by somebody's clinical needs. And that changes and evolves as the disease progresses.
Yeah. Now, on that home follow-up, Eithne, are you based countrywide, or how does it work? And the other thing I want to ask you about, of course, is funding, because funding is essential for all of these services.
Yes, and just to answer your question, myself and my colleague, we do cover the country in relation to home visits, together with being involved in multidisciplinary care meetings in relation to somebody who's diagnosed. And yes, funding is absolutely vital. And the Motor Neurone Disease Association was a very small organisation when it was established initially in 1985. It was set up by a small group of family and friends. And since then it has evolved enormously. I mean, they do, as I said, provide the home visits by ourselves. It also provides specialist medical equipment if somebody who's diagnosed requires, specialised equipment like bed or, whatever is required. We also work closely with the Central Remedial Clinic. And like Deborah alluded to there, things like communication devices if they're required, and if somebody has lost the power of one limb, they can, provide invaluable education in relation to equipment like that. And also the other important thing to point out is that the Motor Neurone Disease Association provides a counselling service if it's required by somebody who is diagnosed with motor neuron disease.
Well, a huge amount of services on offer, it seems to me, Eithne.
Yes.
Helplines. Do you have a helpline or contact?
We do indeed. We have a helpline number, and that number, if I could give it out,
Please
Sheila,
do, yes.
is 1-800 403 403.
Because even maybe somebody listening to this who maybe not directly affected, but maybe has a relative would like to know more, there's information at the end of this line.
There's lots of information available at the end of this line, and indeed our colleagues in the office can forward the call on to myself or my colleague, and if there are any concerns or worries, we're more than willing to help out.
And you do have a website?
We do have a website indeed, and that website is www.IMNDA, which is Irish Motor Neurone Disease Association.ie.
Well, we'll give those bits of information out before the end of the programme again. But Eithne Cawley, nurse specialist with the Motor Neurone Disease Association, in the week when you're inviting people to drink tea for MND, and people can do this anywhere around the country that they feel like doing it.
That's right. The Motor Neurone Disease Association is asking people, it's essentially, Sheila, to raise awareness about this condition. It's very important, because knowledge is power in in any walk of life. And it's important to point out that if people are more aware, and if people could try and raise funds, even by holding an afternoon tea or a coffee morning, and there are tea packs available from the Irish Motor Neurone Disease Association, again, and they can contact that free phone number.
Terrific.
It'd be fantastic.
Eithne, thank you very much for speaking to us. And Deborah, an inspiration to us all, Deborah Hickey, I wish you luck. And before we came on air, I had a quick word with Deborah just to check in, and she told me she'd never done a radio interview before, and I think you've done awfully well, Deborah.
Well done, Deborah.
And we look forward, maybe, you're only down the road in Brewery, we look forward maybe to talking to you again on the programme.
Absolutely, anytime, no problem.
Thank you, Deborah Hickey, very much indeed for joining us. And again, Eithne Cawley, nurse specialist with Motor Neurone Disease Association. Thank you both very much. Now, I give those numbers out again before the end of the programme, but we must take a break now, and we'll be back in a minute. We're 069 66 200 or 087 166 9800. Stay with us.